Hi all. Population health management and related analytics is possibly the most impactful business function when it comes to delivering health outcomes for any healthcare organization. Today, let's take a look at how Snowflake as a data AI platform can power your population health analytics. I'm Jeevan Rag, Principal Industry Architect, part of the Global Industry CTO function here at Snowflake. Let's start off with a quick overview, more focused on what are the key outcomes, what are the top goals that population health analytics is trying to deliver. This is better understood when we segment this from two levels, right? At a population level, this is more about understanding the right kind of programs, the right kind of resource allocations, the right kind of strategies that you have to deploy at a respective patient population so that you can bring the maximum meaningful impacts at a population level. And how is this done? This is done effectively when you can assimilate the richest possible factors that impact the health of the patients that form that population. It's a long statement, but if we break it down, this is about looking beyond your EHR systems, right? Tapping rich multimodal health data about each individual patient and then rolling that into respective populations and deploying advanced capabilities so that you can deduce the right information from these populations and then deploy your resources to bring the maximum outcome for that specific population. But that's not just it. The other side of a successful population health analytics program is also to draw that line from population level to a patient level so that you can go more personalized. You can go more at a granular level and instantiate the right intervention programs, the right reach out programs, the right personalized health programs at a patient level so that you can reduce the care gaps, acting both at a population level and patient level side by side. And that forms a successful population health analytics program. Now that we have established what are the key outcomes and top goals, let us also look at what are the key challenges often inhibiting population health analytics. These challenges can be broadly classified into two categories. The first one is the continued challenge that healthcare organizations are facing in establishing what is referred to as patient data access, the ability to gather information about your patients, information or data that has an eventual impact on their health from all variety of sources, right? And most likely beyond your EHR. And even within your EHR, going beyond the structured elements of the EHR and harnessing things which are classically referred to as unstructured. Because we all realize that the true health information or health impactful information many a times is unstructured in nature. This can be within your clinician notes, this can be within your pathology reports, this can be within your DICOM images. So that ability to go back and harness this rich multimodal unstructured data and then forming that patient health profile has been a continued challenge. The second side of the challenge is where traditional legacy analytical solutions are grappling on how can they derive quick actionable insights from this data. There is no point in getting a great insight if it is coming late. And the keyword actionable is also of paramount importance because this is not about sharing a set of graphs and charts at the clinician and asking them to figure out what is going on. This is about an ability to provide meaningful interventions, action items, insights that truly are actionable for the clinician, physician, or whoever is the persona that is dealing in this continuum of care. Now, for healthcare enterprises that are looking at strengthening their population health analytics, there are predominantly three key pillars around which the broader strategy has to be constructed. The first one is about enabling patient data access. This goes back to the fundamentals of the broader interoperability play, right? The synergy you establish with your partners. How are you tapping into the broader ecosystem so that you can grab and at least access the rich patient information that spans beyond your enterprise, beyond your EHR. And while there are technology capabilities like Snowflake's data sharing, right, or collaboration capabilities, which can amplify this patient data access, it is fundamentally a non-technology problem, right? It is more about partnerships, collaboration, standards, and the broader ecosystem play that has to come out to enable that patient data access for the enterprises. The second key pillar is ensuring that you have the right scalable modern data and AI platform which can help you assimilate and bring in this multimodal health data, hold them together and then transforming them into contextual multimodal health data products which can drive potentially population health analytics or multitude of other use cases in your enterprise. And that leads us to the third and final key pillar, which is around reimagining your population health dashboards through AI infusion. In the rest of the session, we are going to delve deeper into this third key pillar talk around specifics on how Snowflake can propel this reimagining of the Pop Health dashboards, and we will wind it up with a quick demo on some of this in action. Now, let us look at how Snowflake can help you reimagine your population health analytics. At a foundational data layer, the capability that Snowflake provides you is to really induce that multimodality of healthcare data into unified data products. What is listed on the screen are few of the ways in which customers are infusing AI into their pop health workflow. One is around deploying AI into their data engineering pipelines, applying AI to really extract information from unstructured data and pushing it into their data product, generating summaries and insights at different granularities of data. Think about the population level and patient level we talked about. Applying ML models, right? Advanced ML models or endpoints for risk stratifications or predictions. Looking at extraction of specific event informations or clinical data abstractions from this unstructured multimodal data. And then also deploying modern ways of engaging with this data. Think of experiences like truly chatting with the multimodal data product. With that said, let's quickly look at an art of possible. Now, what you're seeing on the screen is a classic pop health dashboard, right? These dashboards usually have a summary level information like what you have on the screen, which talks about, say, trends in encounter reasons, observations, immunizations, whatever, right? There is a specific dimension on top of which you are plotting the data. But there are usually graphs or charts of this nature at a summary level. And then there is sometimes a drill down information to a patient level, which can lead to structured informations like what you're seeing on the screen, which usually originates from the EHR. So we have condition data, allergy data. Now, the topic we'll discuss today is as you unleash AI, right, powered by Snowflake into a construct like this, what does it do to that experience, right? So let me activate Snowflake's AI on top of this dashboard, and you will quickly see it transforming, right? And there are many things changing on the dashboard. Let's go one at a time. The first and foremost impactful change is from this graph and chart perspective, we are quickly served with very specific actionable insights. As you can see, for the population that is undertaken, AI is able to quickly cut through that multimodal data and then tell you very specific insights on that population, specific actions that physicians can take to improve the health outcomes. Also, when recommended, identify the top patients where you can have maximum impact by actions. What are the next steps of engagement? So you can see the generic trend of throwing information for the sake of analytics translating into real actionable insights, right? But where is this information coming from? This information is coming in because the earlier patient detail, which was very much related on structured data, now has really exploded. AI is now powering through your unstructured data and tackling things like pathology report. So a pathology report like this, when churned through AI, we are able to extract very specific information from your pathology reports, right? Whether it is your facility name, your specimens, your diagnosis, very pointed information out. But that's not just it. You can look at use cases like, I'm not going to go through all of them, but something like, let's say, you want to cut through your medical transcripts, right? Roll it up at a patient grain and then extract the SDOH insights of this patient across the entire spectrum of medical transcripts. In our internal specifics, we call this capability as AI aggregate. Think of this like applying AI into a SQL group by clause. Insights and aggregative insights are all meaningful, but you can also deduce new information which was not existing in those transcripts, something like medical coding. The AI cuts through these medical transcripts or the rich multimodal information out there and quickly deduces what are the right CPT codes or ICD codes and the related HCC hierarchies that are associated to that, and also provides you with explainability as in the specific citation or segment within the medical transcript from which this information is deduced. Capabilities like this are usually put into production with a human in the loop. This whole drill is not just limited to the structured or even textual documentation side of it. It can even be deployed into very complex healthcare formats like DICOM. Tackle a DICOM image, right? Translate that into specific summary information or textual information like that you see on the screen, and again put it into your workflow for pop health analytics. The third experience we see where customers are really benefiting out of Snowflake's AI ecosystem is when we start deploying what we refer internally as a Cortex agent or agentic AI on top of this multi-model product. And let's see some of that in action. Just push in some canned questions so that I don't need to type all of them. So think of a journey where you are approaching a population, you're asking a question on What are the top encounter reasons on this population, right? The agent picks up this question, it deploys the right tool, and in this case, the answer to that question lies in the structured part of their data. So that what the agent does internally is it writes a SQL query completely based on this English question that came in, and we can get into more specifics around it in a deep dive session, and it brings back that information. So let's push this a bit more. Who are the patients with encounters related to this? Again, the agent kicks in, it picks up the data. This is, of course, dummy data. There can never be two patients for that disease. There should be more. But in the dummy data I have, there are two patients, right? I'm now going to ask a question that is spanning beyond structured information. Let's push the question and we'll talk through it. So the question was, okay, you told me Ardath has bronchiolitis, but did you find a medical transcript? Or in very simple terms, do you have a PDF document or a medical transcript from where you can sort of quantify this information? And that's exactly what it did, right? Agent picked up that question. It deployed a tool referred to as Cortex Search. It goes against that specific medical construct, which is this specific PDF we have here. We don't need to really read through the whole PDF, but AI has gone in, cut through it, and brought that information of RDAT against bronchiolitis. Let's take a closer look here, and you will see there is a reference of a chest X-ray, right, that was performed on this particular patient. And now you can even follow up asking, okay, I see you are making a reference of a specific X-ray, but do you have a medical image corresponding to that? So think of the journey. Your initial question was a summary level information on relational data. You from there you pointed to a specific patient. From the patient, you navigated to the medical transcript of the patient. From this transcript, you're asking AI to navigate to a specific DICOM medical image related to the X-ray. And it even does that, right? It anchors against the X-ray for that patient and even explains the specific X-ray through medical terminology. I'm not a medical practitioner, so I'm not going to attempt explaining what each of these terms mean. But you can see that power of engagement with multimodal data, right, in its full glory. We'll take a quick look at the high-level architecture behind what we saw. So think of this like Snowflake deploying AI from as a horizontal capability in your broader pop health analytics pipeline. AI is deployed as an engineering capability. Features like AI SQL or Document AI or Snowpark are used as appropriate to cut through that multimodal health data and transform them into multimodal data products, right? And then we bring in our capabilities around AI powered consumption, anchored more around agentic AI with Cortex Agent, who then deploys the right kind of AI services, whether it is Cortex Analyst or Cortex Search, as the user or business process starts engaging with this data. And you just saw that in action. This is the potential of what the platform can bring in as you start reimagining your pop health analytics with AI. To summarize, how does Snowflake help you reimagine your pop health analytics? There are predominantly three different capabilities we bring in. One, Snowflake as a multi-model data platform helps you activate this unstructured multi-model patient health data. It enables you to bring on true actionable AI powered insights. We just saw it on the demo. And the third capability is really to deploy agentic AI experiences like the one you just now saw. That's a quick takeaway, and that is the potential Snowflake brings for you as you embark on this journey to reimagine your pop health analytics. Thank you.